record.
Okay, thank you. So I'm going to go ahead and call this work session to order on AO 2020-65, amending Title 16 by adding chapter regarding medical and mental health practices such as sexual orientation or gender identity change efforts with a minor. If we can go ahead and do a roll call of assembly members.
Yes, Mr. Chair. Mr. Rivera.
Present.
Ms. Quinn Davidson.
Here.
Ms. Allard.
Here.
Mr. Constant.
Here.
Mr. Dunbar.
Here.
Ms. Kennedy. I believe she's absent. Ms. LaFrance.
Here.
Mr. Perez-Padilla. Mr. Peterson.
Present.
Mr. Weddleton.
Here.
Ms. Zalatel.
Here.
You have a quorum, Mr. Chair.
Thank you, Madam Clerk. So as usual for assembly members, if you'd like to get into the queue, please either put yourself in the chat or text me. Before we get started, so today we're going to be hearing from a variety of different presenters, and at the end of all of the presentations is when I will open it up for questions. If we run out of time for questions and discussion, we will look at the possibility of having a second work session so that we can delve into this a little bit more. With that, I'm going to go ahead and turn it over to Mr. Constant to set the frame, and then he will be facilitating the speakers.
All right. Thank you very much. I think most of the presenters are here. My name is Christopher Constant. I am the, one second, let me shut the door. The elected representative for the District 1 in Anchorage. I'm also an LGBT individual who has long been standing in the fight for equal rights and justice for my community. And as I was elected, I have a responsibility to take on the challenges and build on the protections that our country promises under our Constitution. Equal rights and equal protections and equal opportunities. And so to that end, I have been working with my peers, Mr. Felix Rivera and Austin Quinn Davidson, and a host of professionals from across the country and especially across our town and state to bring forward a new piece of code that would codify that the practice that has been strongly found to be harmful to youth, conversion therapy or reparative therapies, will no longer be allowed to be conducted by professional therapists in the municipality. And so what we set out to do here today is hear from a number of stakeholders, including the authors of this ordinance, including members from the Trevor Project, which is an organization dedicated 100% to ending this practice across the country for young people, our children. Then we will hear from a number of healthcare providers, in particular therapeutic providers. We will also hear from Mr. Jim Minery of the Alaska Family Council. And then we'll hear from a few members of, or a couple of members of Christians for Equality, and then finally from two individuals who have experienced conversion therapy. So we'll also, I should have said, we'll hear from our counsel who will brief us on the function of the law. Now, we have a lot of speakers and a lot of information to get through. And so for everybody who's been invited to speak, we're going to ask for a dense message as effectively as you can get it to us. And with that, I am going to turn it over to Sadie Edmondson, if she is on. Sadie, are you here? I am not seeing that she's here. So with that, then I will pivot to Mr. Gates to give us his introduction to this section of the code and how it will work.
Yes, thank you, Mr. Constant. I hope that Sadie Edmondson will be joining us during our meeting. She worked extensively on this. She was a summer intern in my office, and she did exceptional work putting this together and researching issues. So I think she's more of an expert than I am. But let me give you a brief, and I will make this brief. So this ordinance, it in a way is not intended to regulate the profession, but put one simple prohibition on practice within the municipality. And practice, like Mr. Constant said, has been found harmful by a variety of professionals and professional associations across the country. And this isn't a new thing. There's been ordinances and some state law doing some similar prohibition on using this type of sexual orientation or gender or identity change their efforts. And so what we've done here is try to fashion that over the laws that have been withstood challenges to them. There have been some, for example, 2 Ninth Circuit cases from challenging the state of California's law. And our ordinance is quite similar. It's even more similar to a Florida ordinance that Ms. Edmondson had researched that also survived challenged over there. So the language is carefully chosen. Now, how this is going to work, I think, is we're not regulating the licenses of these professional counselors. That's the state's job, but the state that hasn't regulated or prohibited this type of practice. And through the municipal home rule powers that we have under the Alaska Constitution and Title 29 of the Alaska statutes, we're able to regulate anything. We're not prohibited from regulating. This isn't prohibited for us. So it's a legitimate exercise of our home rule powers to do this. Now, we don't have any other code section that has a prohibition on counseling or counseling approaches. So it's a total chapter in our code, and it's under Title 16, which is generally enforced and administered by our Anchorage Health Department. And so this is also designed to be complaint driven. So it wouldn't actively, proactively go out there or look at practices and what they're doing. But if somebody calls with a complaint, then it can be investigated. And if there's violation, probably a notice of the violation. If it's ongoing, then fines can be imposed. So that's how this is designed to work. And I think with that, I should probably leave time for many of our experts that are with us today to speak to the matter. So if there's anything else you would like me to talk about, Mr.
No,
Preston,
thank
Mr.
you.
Sherrill?
It's at this time, what we will do is proceed through the testimony of our experts. And if in fact there are questions about the function of the law itself, we are prepared to host a second work session that's on the technical operation of the code, separate from this meeting, which will be in order to hear from our experts and the individuals with lived experience. And so I don't know if Tracy Weiss is on the phone. Tracy, are you here?
I am.
All right, Tracy. So I am hoping to start with you. For those of you who don't know Tracy, she has, excuse me, I'm sorry, I flipped the deck here. I should step back. Tracy, I'm going to call on you in a minute. First, we're going to hear from the Trevor Project. And folks from the Trevor Project, what we'd like to hear from you is the national context, the function of this law in relationship to the others that you've seen across the country, and just a broad introduction in roughly 5 minutes.
Absolutely, and thank you so much for having us. It's an honor to be here. My name is Casey Pick. I'm the Senior Fellow for Advocacy and Government Affairs at the Trevor Project. I'm a policy expert on the issue of conversion therapy, and I'm also an attorney. So I'm happy to answer questions from a legal perspective as well, if anybody has any. Just briefly, the Trevor Project's interest in the issue of sexual orientation and gender identity change efforts, what for brevity I will refer to as conversion therapy, is that our organization is dedicated to ending suicide among LGBTQ youth. And we know that while our community's youth are 4 times as likely to attempt suicide than their straight or cisgender peers, We know that conversion therapy, LGBT youth who have experienced conversion therapy are more than twice as likely to have a suicide attempt than their LGBT peers. So the issue of conversion therapy and its impact on mental health is of tremendous importance to us. Just to start it out, conversion therapy is any practice or treatment which purports to attempt to change somebody's sexual orientation or gender identity. The idea that you can take somebody who is gay or bisexual and make them straight, or make somebody who is transgender and make them cisgender. This idea is discredited by all of the prominent professional medical and mental health associations, including the American Medical Association, the American Psychological Association, and the American Academy of Pediatrics. And on this basis, 20 states have now prohibited licensed mental health professionals from engaging in conversion therapy on minors, in addition to dozens of cities, counties, and municipalities across the country in states that span the political spectrum, rural and urban. So a little bit about what this particular ordinance would do and how it fits. Its language is very similar to that you see in the 20 states that have prohibited the practice and in the most of the cities and counties that have prohibited the practice. And as your colleague mentioned, this is language that has withstood the test of time. The first of these laws was passed in 2013. It has also withstood judicial challenge, particularly in the Ninth Circuit, where the Ninth Circuit held that these laws were constitutional and the Supreme Court declined to review it, effectively upholding these laws.
I'm sorry, that would be Sadie Edmondson, who's just queued in. Sadie, we'll come back to you.
Hi. Let me, I think, sorry.
Sadie, we will come back to you, so just hold on, please.
Not a problem.
And Casey, go ahead.
Gotcha. Okay. So the question sometimes arises, is this still a current issue? Especially knowing that homosexuality was removed from being considered a mental illness back in the 1970s. And sadly, the truth is, it is absolutely an ongoing issue. In 2018, the Williams Institute at the UCLA School of Law released a study showing that 700,000 LGBT people had gone through conversion therapy, half of whom experienced it as minors. My organization, the Trevor Project, has now for 2 years running conducted the world's largest survey of LGBTQ youth on mental health issues. And just yesterday, we released the results of this year's survey, which had 40,000 respondents between the ages of 13 and 25. 10% of those youth reported that they had experienced conversion therapy. 2 out of 3 reported that somebody had attempted to or gender identity. But let's focus in on that 10% that reported actually experiencing somebody attempting to change their sexual orientation or gender identity. 3% of those reported directly that they had experienced it from a healthcare professional. The 5% said that it was an outside religious leader. The remaining 2% were not sure. So let's call it 3% of youth today who are experiencing conversion therapy at the hands of licensed healthcare professionals. That is far too many, especially given that, again, our survey concluded that 78% of those youth, of the people who we surveyed who had experienced conversion therapy, reported experiencing it before they turned 18. And once again, when we look at the question, have you experienced conversion therapy, and where that intersects with, have you attempted suicide in the previous 12 months? Those who had experienced conversion therapy had a suicide attempt rate of 28%, more than double that of those who had not experienced conversion therapy. I could go on, I could say more, but for the sake of brevity, I'm just going to thank you for your leadership in taking action to protect LGBTQ youth from this dangerous, discredited, and harmful practice. and that I look forward to answering any questions you may have.
Thank you, Troy. Do you have anything to add?
Nope, I think Casey said everything we need to say. Thank you.
All right, are there any questions for this speaker? We have just a few moments for questions.
Actually, Mr. Constant, we're going to be doing questions at the end.
Okay, very good. Thanks. Then next up, Tracy, are you still there?
I am, yeah.
So by matter of introduction, Tracy Weiss is an advanced nurse practitioner who has probably the broadest experience of providing services to LGBT, especially trans individuals in our community. She works in partnership with Identity Inc., which many of you know as an organization, probably the longest organization working for LGBT protections in Alaska. And she has also been an individual who has provided for the municipality professional services in helping with sexual abuse cases, especially against children. So this is an extraordinary professional in our community, and I'm going to turn the mic over to her to give us her perspective on the local situation. Thank you, Tracy.
Yeah, thanks, Chris. So Chris gave a little bit of an introduction. So just as a little bit more background, most of my professional background is in child maltreatment. So working cases of emotional, sexual, physical, child abuse and neglect, as well as several years as a licensed both mental health and physical health provider here in Alaska. My clinic, as far as I know, is the only clinic in Alaska that openly markets and specializes in the care of both the physical and mental health care and well-being of the LGBTQ community. So as a business owner, as a licensed physical health provider, as a licensed mental health provider, I think it's really important that we look at practices that are known to be harmful, not only known to be harmful, but known to perpetuate trauma for a community that has been listed as vulnerable by almost every major health assessment that's been done in every state, and every national health assessment that's been done in the last 10 years identifies the LGBTQ community as vulnerable and at risk and in need of care. So when we're looking at this from a healthcare dollars spent perspective, and we know how much money we spend on complex trauma, whether that be from behavioral health trauma or whether that's physical health issues because of complex trauma, as healthcare providers, we have a legal, ethical, and moral duty to practice interventions which are evidence-based. There is no high-quality evidence base for conversion therapy. In fact, the evidence that we have says the exact opposite, that conversion therapy perpetuates trauma, it increases an individual's neurological trauma response, so they're not going to feel as safe in their communities, they're not going to do as well in school, they're not going to come to work, they're going to end up costing us more dollars in disability and mental health and physical health because the root issues aren't being addressed. Should a person come to therapy in conflict with their sexuality and their core values, a therapist is able to use interventions that are evidence-based to help any patient set goals for what their therapeutic outcomes can be. These are always individualized for the patient. And there's already ways to work with folks whose sexuality and gender identities are in conflict with their core or spiritual values that are not harmful. So it makes more sense for professionals to use interventions that are evidence-based and not harmful to work with folks, whether they want to embrace their sexuality and gender or whether that sexuality and gender identity is causing conflict. We have ways that are not harmful to work with those folks. So it's really important because our healthcare dollars, especially in this community, are already so strapped. We don't have the resources to pick people up from this kind of intervention. It takes way too long and way too many years of undoing harm from people who have undergone harmful interventions by poorly trained and poor ethics by other licensed professionals. So, it's our opinion over here at Full Spectrum Health that this practice be made illegal in our municipality, if not statewide, not only to protect the health and well-being of our patients, but also to protect our already strapped healthcare dollars. Thank you.
Thank you, Tracy. So next we will move on to our resident pediatrician, Dr. Monique Karaganis, who has been providing services in Anchorage for a very long time. It's very important for us to hear from medical professionals, especially medical professionals who serve children. Dr. Karaganis, you have the floor.
Just a little bit of an update. That last name is now Child, Child, so a little easier to spell.
Thank you.
Thank you, Mr. Constant. I am Dr. Monique Child. I work with Polar Pediatrics, and just to keep it brief and simple, conversion therapy has a lot of data that shows it to be dangerous, as well as discredited. It causes a lot of damage that, as Tracy had mentioned, it does increase the amount of care that someone needs to recover from that. As Casey mentioned, it increases the risk for both suicide attempt and suicides. It is a discredited and dangerous practice, and it ought to be outlawed in our municipality. To speak to one point, some people will address statements by the American College of Pediatricians. That is an organization that has a similar name to the American Academy of Pediatrics. The American Academy of Pediatrics is thousands of pediatricians in all 50 states, as well as all of the territories of Canada. The American Academy of Pediatrics, as well as the American Psychological Association and the American Medical Association, all agree that conversion therapy is dangerous and discredited. The American College of Pediatrics, although it sounds similar, has been cited as a hate group because of many of its statements against both homosexuality as well as any parenting that occurs that is not one male and one female. So it is an outdated organization that does not disclose how many physicians are in that group. It's thought to be less than 50, and it's thought to represent not even all of the states. So any statements from that organization should be honestly just discounted. Thank you.
Thank you, Dr. Childs, and I appreciate learning your new name. I've had your old name for a very long time. So next up, we have psychiatrist Dr. Elena Schneider. Dr. Schneider, are you with us?
I am.
Thank you. The floor is yours.
I'm Alina Schneider. I'm a child and adolescent psychiatrist, and I've been practicing in Alaska for 5 years. To avoid repeating what Dr. Childs and Tracy Weiss have talked about already, I wanted to talk a little bit about the harm that can come from conversion therapy. There are treatments that are used that we don't know how effective they may be, or we know that there's a low chance of effectiveness. When someone has cancer and they've tried all the conventional treatments, they may try something experimental. And at the beginning, they're informed about what the risks are, and they're informed about what we know about the chance of success. When that sort of treatment fails, I think people feel discouraged, and I think they also feel heartened that they've tried everything they possibly could. And when individuals are distressed about homosexuality and they try conversion therapy, they can't get the data on the success rate because we don't have good data on that. But what's different about therapy is that it can feel like a personal failure. If I went through 6 years of conversion therapy and it didn't change my sexual orientation, I worked this hard, it wasn't the therapy that failed, it was me. People are casting judgment against themselves for failing therapy in a way that they don't when they fail at other kinds of treatment. And that's deeply harmful, besides reinforcing all the condemnation about the feelings that this person has towards other individuals. The Academy of Psychiatry has had a position paper against conversion therapy since 1998. The Academy of Child and Adolescent Psychiatry has a similar one. And SAMHSA, which I don't think of as a political organization in any way, put out a book in 2015 about ending conversion therapy, basically stating similar points, that we don't have evidence that this works, and we have evidence that it causes harm and that it shouldn't be practiced. Thank you.
Thank you, Dr. Schneider. Can you tell us what SAMHSA is?
It's the Substance Abuse and Mental Health Services Administration. So
it's the federal government, right?
Yeah. Yes.
Right. Thank you very much.
Mr. Constant, you're muted.
Thank you. It happens. So the next speaker is someone who I have participated in many meetings over the years, but rarely on the same side, and probably that's the case again today. But out of due respect to all of our community, we wanted to hear a voice that is not the same as everybody else, so we can have some relief to our perspective. And so, Mr. Minery, I hear you are on the dais here. Are you with us?
Yeah, thank you so much for having me. I mean, I do appreciate this opportunity because I would say we're certainly not alone in our deep concern for what I would call a very, very anti-liberal, anti-choice ordinance in terms of setting these parameters from which parents and minors and professional counselors can operate within. And although it's obviously possible to find instances of abuse and clearly harmful practices, which can and should be prosecuted under law. And so that's the part that I haven't really heard too much of in this conversation is what specifically you're talking about. And the reality is that the ban in California was stopped, as most of you know, because of very, very clear evidence from a group called Changed. And these were people from across the country that came to Sacramento to testify that they had personally benefited. And in fact, many cases were the counseling that they had received had helped them from preventing suicide. And so the reality is that we have to all understand that this is an anti-choice or ordinance. What the Anchorage Assembly is seeking to do is to basically tell clients, particularly minors, what goals are acceptable and which are not. And I think what's happening is that they're judging not based on method necessarily of care, but they're making decisions for clients or parents or professionals and saying which beliefs or goals are permissible. And it just seems really bizarre to me that in today's world, if we have youth, and I've met them, I've seen them, I've been in this for a long time, I know for a fact that there are many kids who are struggling with unwanted, and that's the key word. So I think that we all have to understand that we agree with you on some of these things that have been done in the past and how horrific they are. But this goes well beyond that. And the reason the guy in California stopped the legislation from moving forward because he saw that for himself in real life. And he put it on pause and said, thank you for bringing this other point to the table. And that's all we're doing right now is to basically say, please let us have a pause on this so that there can be the other side presented, which is that there are people who actually have sincerely, truly benefited from, and you can call it whatever you want. Conversion therapy sounds good because it makes it sound like you're converting someone unwillingly. And of course, we would disagree with that. But I'm talking about those who actually want help and who have received it, who have testified across the country. So I would just, again, thank you for giving us a few moments to present another view, and that I can't emphasize enough how anti-liberal, anti-choice this is regarding what the Anchorage Assembly has done. And more than anything else, anti-parental rights. I have people that are calling our organization up in absolute arms to say that there's a few members of the Anchorage Assembly, well, obviously the majority, are saying that parents no longer have the right to provide the kind of counseling that their children themselves are asking for. So with that, I'll end.
Thank you, Mr. Minery. No decisions have been made, so it remains to be seen if there's a majority, but there are certainly 3 sponsors. And make sure to stick around. I do have one question for you. Next up, we are going to hear from Denise Sudbeck. Denise, would you please introduce yourself?
Can you hear me all right?
Yep.
Good afternoon. My name is Reverend Dr. Denise Sudbeck. I want to thank the Assembly for an opportunity to contribute to this process. I'm an ordained minister within the context of Metropolitan Community Churches. I hold a Doctor of Ministry degree from United Theological Seminary of the Twin Cities in Minnesota. Yet at this point this afternoon, that's not the particular hat that I'm wearing as I come to this conversation. I am particularly here wearing the hat of human and civil rights. And it's with that context that I intend to speak this afternoon. There've been numerous people far more knowledgeable than I am referring to the various statements from professional associations. So I really do not want to rehash that other than to say that I support that as well. The one thing I would add to that is that I also happen to be a veteran, a Vietnam era US Navy veteran who identifies as a trans woman. And I've become aware that recently VA policy for healthcare professionals has something to say about this, even within their system. And I quote directly from a policy that says, and I quote, "It is VHA policy that any attempts, formal or informal, by VA staff to convert or change a veteran's sexual orientation are prohibited." And that's in reference to LGB folks, and there's a similar kind of statement as it refers to trans-identified individuals. I'm also addressing the Assembly as a published contributor to at least 2 textbooks on LGBTQ plus civil rights that were written for undergraduate public administration students. And with that in mind, I'd like to make the following statement. We should be able to agree as a community that our mutual goal is for all people, without exception, to be treated equitably as they work to grow and to flourish. And please keep in mind that word flourish. Americans have traditionally enacted laws designed to do that very thing with children, at least through age 18 or in some cases 21. We regulate public school education, including attendance. We restrict the use of chemical substances until at least a legal age of majority. We legislate age requirements in other areas, including employment. These are things we do together as a community, and we do that ongoing. This is, and we do this with one goal in mind, that our children can flourish authentically without hindrance, and so become citizens of the greater community. This is what we mean when we refer to human rights. That is that goal in mind. We should feel like we have adequate grounds to restrict the use of conversion therapy as we have in other areas of shared community responsibility. So-called conversion therapy has been demonstrated to be a destructive hindrance which obstructs a person's ability to flourish, as numerous other people have testified to. As such, it obstructs living authentically into those same human rights and should not be allowed to be practiced in the community. By ignoring those rights, conversion therapy sends a message that who you are, who you understand yourself to be as you grow, is not authentic, and in fact is disordered, and a person's right to grow into a flourishing member of society as they see fit for themselves personally will not be respected. On that basis of that question of disorder, conversion therapy, as we've commented, has already been restricted by statements from all manner of associations and professional associations and people across the United States. I would also like to add this, that different is not the same as disordered and should not be a rationale for denying any person at any age widely recognized civil and human rights. Conversion therapy should not be allowed as a pseudo-corrective to mental health because it is not a mental health issue either, even though it can and will create or complicate mental health issues to which other people have already testified. To learn to express sexual orientation and gender identity leads to a healthier possible outcome, which is what I've been meaning when we're talking about that word flourish, the ability to flourish as a citizen in our community. And so it should remain an issue of civil and human rights. Children should not be forced to surrender those basic rights or live in fear, secrets, or shame of what might happen if they divulge or even ask questions. People should not have to wait until they are 57, such as myself. I'm speaking about this personally.
Denise,
Out of,
I've been asked to just kind of ask you maybe another 30 seconds.
yeah, I'm almost there.
All right, thank you.
Out of fear of rejection or being stigmatized or labeled in any such way, especially out of fear of what parents and other authority figures might do. The complications of abrogating those rights is not only personally destructive, but does not serve any community well, which is intent on all citizens flourishing. Thank you.
Thank you, and I'm sorry I had to interrupt you there.
No, that's all right. No problem.
All right, Mr. Schultz, why don't we let you have 2 minutes?
Hi, thank you for having me here this morning. I'll echo many of our previous speakers. Dr. Child in particular referred to this type of conversion therapy as dangerous and discredited from a scientific point of view. And I would like to lift my voice with others and say it is also dangerous and discredited from a theological and spiritual point of view. This type of utilizing religion as a weapon against a person's knowledge of self is harmful and destructive to a person's soul. The suicide rates are so high amongst this marginalized community, and I think it's only appropriate and fair that we point out that the majority of the pressure and pain placed on people in the LGBTQ community comes from harmful religious practices. So those of us in the religious community, those of us in particular who are ordained as ministers, need to stand up and confess our complicity in that damage having been done and work hard to prevent it from ever happening again. The majority of every Christian denomination is opposed to this type of abuse and harmful behavior. And so it's not fair to frame this as an anti-choice measure. It is an anti-abuse measure. No parent has the right to abuse. No religious institution has the right to abuse. And we depend upon the laws to protect not only the civil rights of every single citizen, but also the common humanity and the inherent worth of each and every person. So I and Christians for Equality would like to stand up in support of this current measure here to ban conversion therapy. Thanks.
Thank you. And now we're going to roll back the agenda slightly. Ms. Edmondson, are you still on the line? If you're muted, I think it's *6. Okay, well, I hope maybe we get the chance to hear from Sadie. If for no other reason, then I like to give credit to the people who do the work, and she was instrumental in doing the deep research we needed to craft this message and to craft this code amendment. And so as an intern, her future is bright, and I wanted to make sure that she is formally part of this record. So one last chance. Are you there, Sadie?
Yeah, I'm muted.
All right, why don't you go ahead and give us your thoughts? A couple minutes.
So, first off, right now there's actually 72 municipalities, 2 territories, and 20 states that have bans on conversion therapy for minors. The most important thing for this that other courts have found that have had their conversion therapy laws challenged have been things such as the state has an unquestionably substantial interest in protecting citizens, especially minors, because of how vulnerable they can be to particularly harmful practices, especially from a professional or another adult. They've also found that the state has a very legitimate interest in protecting the psychological and physical health of minors as well. And there's also been a finding that this type of speech between a therapist and a client isn't always expressive, because the therapist and the client can still express these views outside of this type of thing. But overall, just these statutes, they held against every constitutional challenge you could think of: overbreadth, vagueness, violation of freedom of religion, violation of freedom of association, freedom of speech, right to receive information, right of parents to make decisions. I mean, the courts have looked at this from every single angle, and they have found that it's narrowly tailored like it's supposed to be for things like this. And I mean, everything that I've personally heard about conversion therapy is horrible. I've had friends who were forced to go through it, and it's been one of the worst experiences of their life. And I mean, anything that I could do to help them, that's why I think it's incredibly important to protect minors from such predatory behavior.
So, Sadie, I just want to express directly my gratitude for you for taking the lead on this project. You weren't privileged to this conversation, but there was a moment when the three sponsors and I were sitting with Dean, and he was, I would say, filled with glee by saying this might be one of the most valuable pieces of law he's ever worked on. And we all recognize that you're a builder of that. So put this on your resume if this passes. Now we're going to turn to the heartfelt part of this conversation. We have two individuals slated to speak to us who survived this kind of treatment in our community. And so next up, I would like to invite Mr. RJ Johnson if he is on the line.
I'm here.
RJ, you have the floor.
Thank you. So the interesting thing for me in hearing this conversation is what I went through and what I survived would not be illegal under this ordinance, because it was all done within the church that I was raised in, not only through therapy, but also through a practice that is called deliverance, which is a form of exorcism to try and cast the demons of homosexuality and other sins out of you. After surviving that in my teen years and still staying true to my authentic self, years later, I became a writer for the Anchorage Press, and where I still currently write. And I was challenged by my editor to publish my story. And this led me to interview several other people that live in Alaska that made my experiences seem like nothing. And I am talking stories of children being threatened to be sent away, children being threatened to never be allowed to go to school again, being taken away from their friends, being punished simply for stating that they think they might have an inkling of being bisexual or gay. In the very worst case, one young man was told by his family he was going on vacation, and the next thing he knew, he was at a conversion therapy camp. When he did not want to go to chapel and did not want to pray, he was chained to the floor. He was punished by having his head shaved so hard that they cut into his flesh, and he still carries those scars to this day. He was starved. He was kept away from water because until he lied about who he was and told them that they had, quote unquote, cured him. And finally, he was able to come back home. He's living a happy, authentic life, but he is one of many people I know that are still healing from the scars that this can cause. And I wanted to reiterate, again, what I went through would not be illegal under this because it was done within a church. If we can stop it from happening in actual doctor's office and therapist's office, we have to do everything we can. Thank you.
Thank you, RJ. These personal stories are what makes this meaningful to me. And next we have Lillian Lennon. Lillian, are you on the phone still?
Yes, can you hear me?
Yes, thank you. And now I am appreciative of you being here and being willing to share your story. And so the floor is yours.
Thank you, Chris. Yeah, I mean, obviously this is going to be pretty hard. I wasn't sure if was going to be able to make it today, just based on how traumatic of an experience this was. But I decided I needed to push through it. It's just far too important. My name is Lillian Lennon. My pronouns are she, her, hers. I'm a lifelong Alaskan, and I'm a queer trans woman. There are many reasons to adopt an official ban on conversion therapy. It's shown to be ineffective at converting, which, although is an abhorrent goal, is its prime goal. It's harmful to the LGBTQ+ community, especially our youth, known to cause PTSD, depression, and bring about a higher rate of suicide. It perpetuates a stigma against us, treating sexual orientations and gender identities other than heterosexual and cisgender as mental disorders that need to be cured, which according to our leading medical professionals on the topic is not the case. And I speak today against conversion therapy and for the conversion therapy ban as a survivor. At around the age of 14, I came out to my family as transgender. Expecting love and acceptance, I was instead forced to hide my identity, restricted from attending school or going out in public. Because of my identity and honesty to my family, I felt unsafe at home. I remember explicitly being told by my mother at the time of my coming out that as long as I was under her roof, I would not be accepted. It was not long before I decided to escape that situation and run away, hiding at the downtown Covenant House before I was abducted by two men hired to quite literally kidnap and transport me to a lockdown facility where my therapist practiced conversion therapy. Upon being admitted, I was forcibly strip searched before grown men and kept in a 4x4 confined brick room until I complied. I was housed with men and boys as old as 20, subject to verbal, emotional, physical, and sexual abuse, allowed and even at times encouraged by facility staff. While there, I underwent therapy designed to suppress my identity and to accept a false reality pushed onto me and punished when I didn't comply. On one occasion, I can remember being subjected to isolation therapy for nearly a month after being told I was so close to being able to leave and go home. For 2 years, I suffered in these facilities. I was not given a choice in the matter, which apparently is important. I was denied my identity and humanity, and obviously, I've come out on the other side, still queer, still trans, but working through years of trauma as a result. My parents have since regretted their decision to send me to these facilities, but the damage obviously still remains. Many on today's call will remember that Anchorage decided in 2018 that LGBTQ+ individuals deserve inherent dignity and have inherent humanity. I was one of the leaders in the anti-Proposition 1 campaign and made sure that it was defeated, and obviously it was. I'd pressure you today to make sure that that decision's heard, even though it does not directly pertain. It shows that this city believes that everyone should be treated equally, no matter if you're LGBTQ+ or not. Thank you.
Thank you so much, Lillian. All right, so that concludes the slate of speakers that we have proposed. I have two housekeeping items before we move back to the chair, who will then take questions. The hearing itself is scheduled for our meeting on July the 28th. To all the public that might be hearing this, please consider attending or leaving testimony by email or call. And then also one thing that we made a recommendation by email, but I'll say it here. If you get the opportunity, you can stream on Amazon a movie called Boy Erased, which is a true life story made into a very extraordinary film that really shows you the course of this treatment and the impacts it can have on a life. And with that, Mr. Chair, I turn this back to you to facilitate our conversation.
Thank you, Mr. Constant, for the work to organize all of the presenters today, and thank you to the presenters for your words. We're going to go ahead and start discussion, so if you want to get in the chat and let me know if you'd like to ask any questions of our presenters. So first I have Ms. Zolotel.
Thank you, Mr. Chair. My question is actually for council or Dean on the AO in terms of enforcement or the private right of action. I'm a little bit curious about that section and would love to have a little bit more of an explanation. I'm sorry, I'm kind of stalling as I pull it back up to switch between screens. I apologize, but it's section D, as in David, on page 3. I guess what I don't understand is the 30 days written notice to the municipal attorney or department if you're otherwise authorized to bring a civil action.
Yes. So this language and this paragraph about private right of action, this isn't new. This is actually language that's in many of the places in our municipal code. And it basically, because, you know, our municipal resources and sometimes our enforcement resources are limited, but the code has a ban or restriction or public nuisance that's affecting private property. It provides all these number of situations, the ability to have a private right of action. So someone who's aggrieved by a violation of the code provision like this ban on conversion therapy can go ahead and prosecute their rights themselves. But the reason for giving the municipal attorneys some notice is so because it's, like I said, enforcement resources. The municipal attorney might take up the cause or monitor what's happening in the private right of action. And that's really all the purpose of notifying the municipal attorney is just to give the notice that there's private action about vindicating a violation of code that's occurring. So I hope that helps answer your question. Again, though, this is in many other places in code. And I should add, though, that in my 15 years experience in the Department of Law, I don't really recall actually seeing a case brought under one of those private rights of action paragraphs. But that doesn't mean they didn't. I just wasn't aware of one. But it's there and it's available and it's a legal recourse.
Thank you.
Thank you. Mr. Weddleton. You're on
Hi,
mute.
can you hear me?
Yeah, I can hear you now.
Am I unmuted? Okay, I have a couple of questions, and it's coming into this topic fairly ignorant. Maybe that's pretty typical. So there was a survey mentioned that seemed quite extensive, and that showed kind of people had gone through conversion therapy, that it had not worked and caused a lot of problems. But I wonder if that survey were targeted at the LGBTQ community, that were there people for whom the conversion therapy worked, that they would not have been in that survey. So it would have skewed it towards people who, you know, had, you know, a lot of trauma from the therapy. And I don't know if that speaker is still online.
That was the Trevor Project.
Certainly. With regards to the survey, it was addressed to 40,000 LGBTQ youth. It ranged a full gamut of questions with regards to mental health and other activities. I do not know how one would seek to address a survey specifically and exclusively to individuals who have been subjected to conversion therapy. That said, another presenter mentioned the SAMHSA report that came out in 2015. This came about, was produced through the CDC, and that expressed a consensus among mental health professionals, having done a comprehensive literature review of every study and survey that has been done that touched on therapy efforts with regards to changing sexual orientation and gender identity, and concluded that there was no credible evidence that supported it being effective. While I have the microphone, I will, if I can just offer a bit of clarification on something that was mentioned earlier about the state of California. California did pass legislation prohibiting conversion therapy in 2013 in the mold of what this measure would do, prohibiting the practice by mental health professionals on minors. There was a bill that was discussed in the last session that was actually much broader. It would have declared conversion therapy as practiced by anybody for a fee or compensation to be fraudulent business practice. And that bill was eventually pulled back in order to further discuss the effects of what that means for selling products. So California does indeed have the longest running conversion therapy ban in the country that has withstood the test of legal challenge.
Any follow-up, Mr. Weddleton?
No, that was good. I have like 3 others, but I don't, if there's other people in the queue, I don't mind rotating around.
Sure, I'll come back to you after I go back through the queue.
That's fine.
Ms. Quinn Davidson?
Thanks, Mr. Chair. I'll keep it brief because I want John to have plenty of time. I just want to thank our speakers and particularly Reverend Schultz for, and Denise as well, for calling out organizations of faith for perpetuating some of these problems. And I know that's not the issue today because that's not what our ordinance would do, but I just really appreciate that and think it's really important that we all come to terms with what we've done to various groups of people to perpetuate damage. So thank you for doing that. And then I just wanted to particularly say to RJ and Lillian that we just really value hearing your story, and it must be really, it takes a lot of bravery to come here and talk about something that raw and difficult. So thank you for doing that.
Thank you. Mr. Dunbar?
Actually, can you come right back to me? Somebody just knocked on my door.
Sure. Mr. Weddleton?
Sure. So now if I understand this would only apply to like health practitioners and so on. But we heard from one that, if there's a, therapy or some routine, whatever it might be, that is bad and doesn't work, then it's already illegal, or bad and damaging to the patient, then it's already illegal. So why this ordinance then, if that's true? And if, I guess to one of the doctors.
I think this is Dr. Tracy Weiss, nurse practitioner. I think that was in reference. I think it's really important that we are making sure we're using the correct language. So there's scope of practice, which is published for us as healthcare professionals by our professional associations. These are not laws, but these are scope of practice guidelines which dictate what the majority of professionals in our professional group find evidence-based and patient-worthy. So what we were saying, which might be misinterpreted, is that all major professional associations that oversee the scope of practice, so the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, the American Psychological Association, that all of these major professional associations have published specific opinions and white papers and other position statements which say that this practice is unethical and harmful. Unfortunately, providers providers can practice outside of the scope of practice guidelines because nobody is overseeing that. So unless we have it in law that it is in, or in some kind of ordinance or code, as Chris said, I think the word was codified, that this practice is specifically illegal. Again, we have that level of oversight because unfortunately we know that not all healthcare providers practice ethically. And so if you were to practice ethically, you would be following the scope of practice. But the laws allow us to make sure that if these practices are happening, we have a course of action to take to make sure these professionals aren't harming the general public. Thank you.
Okay, can I follow up?
Sure.
So, I mean, is there an organization in mental health or whoever it might be that could pull your license, like a doctor? We've had doctors that are kind of pill pushers, when they get their license pulled. Is there within mental health a body that would pull someone's license so they can't?
No, because
operate
licenses
legally?
are regulated by state boards. So state boards are the only bodies that have the ability to pull licenses. Most professional organizations offer certification, not licensing.
Oh, so it's not, and certification is more like good housekeeping, seal of approval or something like that. You can have it or not.
It depends on if it's a requirement for your licensure by your state or not.
Oh, I got, okay. Well, that's important. I didn't mean to be demeaning there. I was just drawing
No.
Okay.
It's confusing. Yeah.
Okay. Well, I got two more. I can wait. If you want to rotate.
Yeah, I'm going to go back to Mr. Dunbar and then I'll come back to you, Mr. Weddleton. Mr. Dunbar.
Thank you, Mr. Chair. And so Ms. Quinn Davidson already made the comment that I wanted to make, which was to thank everyone for presenting, but particularly RJ and Lillian for their firsthand testimony. And I'll have more to say when we get into debate about how the many emails we've gotten have ironically sort of convinced me of how timely this ordinance is, which I maybe hadn't realized before. But And also, one of the presenters who, I don't know if she's still on, answered my question about California. So I really appreciate that there is a law in the books, and I assume that there are a variety of municipal ordinances as well. My question for you, Dean, is about, I think it's similar to what Ms. Zolotel was asking, maybe a little different, about the private right of action. So the way I'm reading this, the way I'm thinking about it is the 30 days written notice to the municipal attorney or department, and I assume it's the health department, right? And for the sponsors too, the health department is the portion of the municipality that is envisioned being the sort of enforcement agency for this. And someone please correct me if I'm wrong. But the reason that 30-day written notice is needed is because if the municipality takes action, then there is no private right of action. Is that correct, Dean? That that exists if municipality doesn't take its own corrective action?
Mr. Dunbar, yes, I think the way you stated it, well, I might have stated it differently, but yes, I think you're correct in how you understood it. And also the reference to department in that language is defined generally in Title 16 as the health department, unless otherwise in the context of whatever section it's in. And here we haven't defined any other context, so it does mean the health department. That is correct. And again, the private right of action, sort of the notice is your intent to pursue that. But if the municipal attorney or health department, commits some resources to take up the enforcement action, then that's right. But it's still the person who's been aggrieved or been victimized by this harmful practice. They're still part of the case, so the witness, and so forth. They'll be interviewed, things like that. So it doesn't really say you don't have any right. But this private right of action, I think, is just to get the person fined, and that fine doesn't go to the person bringing the private right of action generally. So this is just to vindicate rights and enforce the ban, either by a municipal attorney, health department, or that last alternative, the private person who's been harmed.
Thank you. Mr. Chair, can I ask a quick follow-up to that?
Sure.
So in Section D about the private right of action, the individual aggrieved has an option for injunctive relief, but then the municipality, our recourse is a civil penalty. Does that mean that we don't also have the ability to seek an injunction, or is that implied or just generally part of the police power?
Well, there are this section refers to the civil penalty. I believe, though, that in Title 16, there's general provisions that apply to all of Title 16, where this new section would be placed that does provide for injunctive relief. Now, you may raise a good point, though, so I will look into this and see if maybe we should add the injunctive relief remedy section or language here as well.
Thank you,
we
Dean.
can do that by amendment if needed.
Thank you, Dean. Thank you, Mr. Chair.
Thank you. Ms. Zolotel?
Thank you, Mr. Chair. So I'm reading this provision again on the private right of action, and actually I have two concerns. One is the 30 days could prevent a private citizen from bringing action for injunctive relief for 30 days. That seems like a long time if there's something harm. I mean, you're alleging imminent harm when you bring an injunction. So that's a bit of a disconnect for me. And the other is I'm feeling like there's a tension here between municipal enforcement and the fine structure versus still maintaining the private right of action, even if the municipality moves forward assessing fines or taking its own action. I don't want to see where the municipality chooses to take action that the other person is somehow precluded from maybe their own private right of action for their own interests, because there's two different sets of interests here.
Well, I would add, these are good points. I'll look into this some more. I would add, though, that this private right of action is only about imposing the civil fine for violating the code. So if there's other harm and so forth, there's still a tort action that someone could take in order that you've been harmed by some negligent practice by the professional counselor and so forth. And since we have a ban in code, that actually helps bolster that sort of tort action. Now that's a little more complicated and having expertise in that sort of a private civil action. This private right of action doesn't foreclose the ability to take other civil actions for whatever damages someone has suffered.
That's helpful. Thank you. Maybe we need to provide that clarification, but I'm happy to defer to you, Dean.
Thank you. I'm going to go back to Mr. Weddleton.
Thanks. So, one of the speakers listed a number of things, that we restrict for minors, and I've obviously been, supported, 21 for cigarettes and so on. But it's like we make a kind of fundamental difference with kind of medical treatments. We just that seems to be in a special place where we keep our hands off. And it just kind of the things that speaker had listed seem to be like, okay, well, they're not in that, but when it's an individual sitting in a room with a doctor and talking about whatever the medical issue might be, we butt out, and even in the most controversial areas. And I mean, is this not in that category? I don't know who to direct that question to, so dive in, anyone.
Mr. Weddle, Mr. Weddle.
Is going to speak. I might just briefly add that I think there was a number of 70 municipalities across the country have added this to their codes. And so I will step out and just say this is not breaking ground.
So, Mr. Weddleton, sorry if I mispronounced your name. This is Dr. Child.
You did perfect.
I appreciate your concern, because I too think that the physician-patient relationship ought to be held sacred. This is compounded by the fact that we're talking about children, and they may not be as developed in being able to protect themselves, having grown up in a home that maybe is not allowing themselves to be who they are. This attempt to convert has been shown in multiple instances, even just today, with people who've survived it and then have great PTSD, depression, anxiety, and other negative ramifications. And so just like in the case of child abuse, we ask society to protect children. This is the same kind of situation. Simply because the abuse is being carried out by a licensed therapist doesn't change that it is in fact abuse. So this is, as Ms. Prick said, or Casey, this is dangerous and discredited. And really it is about the protection of minors so that they're not being exposed to a harmful treatment simply because of their parents' misguided attempt to change something that cannot be changed.
Mr. Chair, this is Mr. Constant. I actually have to go pick up a child and escort her to the courthouse for an interview with the judge. And I hope this conversation continues, and I will be grateful when we get to the hearing. And Mr. Minery would like to be heard.
Thank you. I want to actually see if Mr. Weddleton has another question, because I thought he did. And then I'll go to Mr. Minery.
Well, I do. I mean, if others wanted to address this particular one, that would be fine. I think.
Do you want someone else to address it, Mr. Weddleton?
I don't know. I heard some dinging, and I don't know what you're seeing there, but I'll go ahead.
Okay.
I mean, that's what I'm grappling.
I'm going to go to Mr. Minery then. Mr. Minery, are you with us?
Oh, sorry. Yeah. So it seems like one of the elephant in the room that hasn't been discussed is that, we're talking about human flourishing, but the reality is that we're only talking one way to find human flourishing. So the biggest concern that I hear from people about these kinds of bans is the freedom of the client themselves. So I guess the honest question that I want someone to answer is, if there is a minor who has unwanted same-sex attraction or gender confusion, and who is actually willingly seeking assistance, either from a pastor, from a youth counselor, or a professional counselor, would this ordinance prevent that counselor from providing the service to an individual minor who's requesting the help, and the parents are in support of that child for wanting to get the help that they're asking for? And so the whole concept of discredited in regard to anybody who can make the switch from being homosexual to heterosexual, or from being having a gender identity issue, then going back to what the biology is, to say that that's not human flourishing for those people who are living today. And again, the California issue is still relevant, because the reason why they put that on hold was the enormous number of people who came forward and said, my life has changed and I am now flourishing because of the counseling that took place. We're not saying anything about the horrific things that these people have talked about with Lillian and RJ and Denise. We agree with that. That's the part that we agree with on. What we don't agree with is that the definition for human flourishing is going one way. And that because people have made the decision to go from homosexual tendencies to heterosexual tendencies, that's discredited, even those people who said that counseling helped. And so that's the big elephant in the room that I don't think has been addressed at all. And I really feel like it needs to, for the community to have some sense of what's going on.
Thank you. So before I turn it over to one of the health practitioners or the Trevor Project, if any of them would like to respond, at this point, we have a few minutes left, so this will likely be the last part of the meeting. Then I will adjourn this meeting. And just based on, I don't see any other questions in the queue, I will not schedule a second work session, and we can handle any other questions during debate on the 28th, as well as the public hearing. With that, I'll turn it over to one of the health practitioners or the Trevor Project if they'd like to address Mr. Minnery's comment.
I'd like to respond if I may, and then one of the health practitioners can follow up afterwards.
Go ahead.
There are reasons why when we speak about conversion therapy, we point out first that it is ineffective and then that it is harmful. Just because there are those who continue to find some measure of hope that, well, what if there is that youth that very much wants this, that wishes it would work? And the sad thing is, from that perspective, we have decades of evidence and science and countless testimony from survivors demonstrating that this does not work, even if that goal was one that was laudable. So, and speaking as a representative of the Trevor Project, I'd like to introduce a little bit about what we hear on our crisis lines, the 24/7 telephone, text, and chat suicide prevention lifelines that we provide from youth who reach out to us in some way related to conversion therapy. They reach out to us because their parents are threatening to send them to conversion therapy. Others because they are actually undergoing such treatment, it's not working, and their feelings of isolation and failure contribute to suicidal thoughts and behaviors. We've had youth reach out because friends and loved ones are being subjected to these practices, and youth have reached out to the Trevor Project because someone they know has died by suicide during or after being subjected to conversion therapy. So when somebody raises to me the prospect of a youth asking for conversion therapy, I remember the stories of the youth telling me why they consented to this practice, if they consented. And often that is premised on fear, or at the very least, it is not premised on the idea of informed consent, which is baseline for the idea of somebody engaging in mental health practice, especially a practice that has been demonstrated not to be effective and to be potentially harmful.
This is Dr. Tracy.
This is Jim Minnery again.
Sorry,
I wanted
sorry, folks. Actually,
I
need to
was
do a
hoping that we could
procedural thing
actually
really
have
quick.
the question answered.
Yeah, hold on. I have to do a procedural thing really quick. So I would like to extend this meeting by 5 minutes. Can I get a motion?
So move.
Second?
Weddleton.
Second.
Is there any opposition? Okay, seeing none, then we'll go until 2:40. So I'm going to go ahead. go to a health practitioner, and then Miss Allard.
This is Dr. Tracy Weiss, if I may.
Go ahead.
Mr. Minery, I feel like I did address your question. It's not like it's uncommon for individuals to come to a behavioral health provider because some aspect of self is in discongruence with a core or a spiritual value. I feel like, as was pointed out by the Trevor Project, the difference with conversion therapy is that it's oftentimes an agenda that's motivated by parents. And I, in my experience, have never, I've worked with lots of people whose sexual and gender identity are in conflict with their spiritual or core beliefs, but I've never worked with anybody who is seeking out conversion therapy specifically. So I think we really need to clarify that it's already an option for children to request therapy and receive therapy for aspects of self that are not in alignment with spiritual or core beliefs. My understanding of this piece of legislation is that we are banning practices which don't involve an informed consent process and involve specific interventions which are harmful. So I hope that maybe further answers the question.
And again, Mr. Minery,
I would like
this is Dr. Child.
Hold on, Mr. Minery. So I'm going to go ahead, go to Dr. Child, then I will give you time to respond, and then I will go to Miss Allard, and then I think that'll be the end.
Mr. Minery, this is Dr. Child. Like nurse practitioner Tracy had mentioned, it is possible for people to have gender fluidity and have changes over the course of time. And that can help with support from a multidisciplinary approach, which includes endocrinologists, pediatricians, therapists, psychiatrists. And so this law or ordinance that's being passed would not limit someone's ability to seek, if it is self-motivated within them, any of the care that they're looking for. And that's the fundamental difference, I think, that you're referring to as an elephant in the room.
Yeah, I would say that's certainly it. I mean, we've said like I said, we all agree on these kinds of coercive measures, that they're horrific, that they should be illegal, that it should be wrong for that to happen. But that's not the concern that those who are in my arena or my side of thinking are concerned about. They're concerned that that's happening, if it is happening, and it shouldn't be happening. But the bigger concern is that it's not necessarily specific practices that this is trying to prohibit. It's prohibiting certain values, because if there are some people that would say, hey, I want I'm struggling with this issue and I want help with it. That's what the Christian faith is all about, is for people who are struggling with different issues. And so to have that be illegal for those who genuinely want that help, it's almost incomprehensible to me in a country that those people couldn't get that, or if they did get it with a willing counselor, it would be considered illegal. And so what I'm hearing is that that's not the case, and I'd love for that to be just a little bit more overt, so that people would maybe not be so anxious about this from my perspective.
Thank you. Miss Allard?
Thank you very much. So not only am I a mom, I'm concerned with my parental rights as a mother and as a parent, because I know my children the best, that I should be able and afforded the opportunity to bring my children to who I want to. And as a woman who's brought their children up with faith in our life as Christians, to take my moral values and my children's moral values and our compass to give us the right direction in life, to make that illegal process is absolutely a violation of our religious freedoms. And I would love to continue this conversation. I respect all those people who have concerns. I do not support the brutality that has some of this conversion therapy has gone wrong. That is not okay. So I want you to know that. My biggest concern is parental rights and our religious freedoms with our religious counselors and our therapists to be able to help me guide my children and my family as I see fit. And I appreciate each and every one of you. And thank you so much for your time.
Thank you. So with that, we are gonna end this work session. We have the public hearing on July 28th, and welcome
Mr.
everyone
Rivera?
to provide testimony on July 28th. And yeah, I apologize, Dr. Child, but I do have to end this work session. We have a meeting in a few minutes that we have to get to.
Okay.
Thank you everyone for presenting. This work session is ended.